Low vision, what it means and how to deal with it. Low vision means visual acuity of 20/70 or worse in the better eye that is not correctable with glasses or surgery. A vision of 20/70 means that you need to come to 20 feet to be able to clearly read a letter that a person with normal vision can read from 70 feet. Count fingers vision means a person can count how many fingers a person is holding in front of them, but cannot read any letters on the chart. Low vision does not necessarily mean legal blindness. In addition, even if you have legal blindness, don't let it scare you into thinking that you're completely blind. Just take the fear out of your mind. Legal blindness does not equal functional blindness. Legal blindness just means that your vision loss meets a certain legal definition. In fact, most people with legal blindness still have lots of remaining vision that can be used to function independently. Whether you have low vision or legal blindness, low vision consultation will quite likely be helpful. Advanced macular degeneration can cause a blurred area or missing area in the center of the vision. You may sometimes see shapes, animals, or even people in areas of advanced vision loss, and this is harmless in a well-known condition called Charles-Bonnet syndrome. It's your brain's way of trying to fill in the blank spots in your vision. Don't worry, you're not losing your mind. Even if you do not have advanced AMD and your vision is worse than 20/40, you may still benefit from a low vision consult. A low vision specialist can evaluate your vision needs, suggest tips and low vision devices that can help you perform your desired tasks, train you on using those devices, and maximize your function by visual rehabilitation. Make a list of daily tasks or activities that you need help with and bring samples such as medication bottles, bills, magazines, etc. to your low vision appointment. Here are some basic tips and tricks on how to deal with low vision. Surrounding modifications such as lighting. So when indoors, you can use 1 or 2 gooseneck style lamps of high illumination that can be directed towards the reading material or your task over the shoulder. Portable lamps and LED lights are convenient to take to stores, restaurants, and card games. Hold within 1 foot of your desired task for maximal illumination. Clip-on LED lighting to attach to your glasses can help illuminate the food that you're eating or medicine bottles that you're looking at. Visibility. When outdoors, use sunglasses with UV protection. Avoid sunglasses that are excessively dark because a darker lens reduces the amount of light that reaches the retina and subsequently makes it harder to see, especially with macular degeneration. Try different shades of darkness to find which one does not compromise your visibility. Contrast. Yellow, orange, and amber tinted glasses improve the contrast, depth perception, and make objects appear brighter in macular degeneration. Backlit electronic devices can improve contrast as well. Light-colored dinnerware or food placed on a black placemat is visualized better due to improved contrast. On the other hand, black coffee placed in a white mug is better visualized than in a dark-colored mug. Avoid multicolored or decorated plates as the food can be hard to see on them. Glare. When indoors, avoid lighting from your side or from the front, and rather have lighting oriented coming from over your shoulder. When outdoors, wear polarized sunglasses. Even when sitting outdoors in the shade, sunlight can reflect from the water, road, etc. and produce glare. Polarized lenses can help reduce this glare and improve visibility and reduce eye fatigue. Notice a glare that disappears with polarized sunglasses. Clarity. Ensure that your eyeglasses are free of smudges, dirt, or scratches. Treat dry eyes using artificial tears to optimize the corneal surface and reduce distortion. Refraction. Have a low vision optometrist prescribe you the best optimal refraction possible. If using prescription glasses with bifocals, extra bifocal add power may be required for your low vision needs. Magnification. Angular magnification. Low vision devices such as magnifiers and telescopes can certainly help and will be discussed later. However, there are other ways magnification can be achieved as well. Relative distance. Get closer to objects you want to see. For example, instead of watching television at 15 feet, get closer to about 3 feet. Magnification. Relative size. Use checks designed for visually impaired that have large print and yellow background. Use bold lined paper to write on. Label medicines or groceries using large white labels with black bold writing using a black felt tip pen. Write using big letters. Use a telephone or keyboard with large size numbers or alphabets. Visual rehabilitation and adaptation. Reading exercise number 1. Look at a word and spend time trying to find areas of missing vision. Then, practice moving those bad areas out of the way and use areas with good vision to read the word. Reading exercise number 2. Identify alphabet characters that look similar and make a mental list. The next time you see that alphabet character, you'll remember that it could be misleading and what the alternative alphabet letter could be. For example, M, N, V, W, E, C, and O, C, G, O, Q, I, T, J, L, 1, D, B, P, R, H, N, or R. Low vision devices. It's important to have accurate prescription glasses. Clip-on loupes can fit on top of your prescription glasses and work as magnifiers for doing fine work at a close distance. Handheld magnifier is portable and easy to use. It can be held against whatever you want to magnify and moved as needed. Illuminated or lighted magnifiers provide illumination in addition to magnification. Stand magnifiers are useful for doing tasks or reading with both hands free. Light gathering and magnifying domes like MagnaBright can be moved along desired reading material. It magnifies while at the same time illuminates by focusing ambient light. Handheld video magnifiers like the Ruby digitally magnify reading material. Closed-circuit televisions such as the Merlin consist of a tray where an object or book is placed. A camera obtains the image and displays on a large screen. It can tend to be expensive but provides the greatest magnification, and it's useful when the vision is 2400 or worse. It may also have optical character recognition for text-to-speech functionality. The handheld telescope. It's portable and it's helpful for reading signs or house numbers in the distance using one eye. The binocular telescope is suited for prolonged distance viewing, such as watching TV. Spectacle-mounted telescopes may be monocular, such as this one, so the other eye can continue to scan the surroundings. Bioptic telescopes are mounted on the upper part of the lens and allows switching between regular and magnified vision. Bioptic telescopes like this one from Occutech is available in different strengths. Most states in the U.S. permit those with mild to moderate central vision loss and intact peripheral vision to apply for driving privileges when using a bioptic telescope system. Ask your eye doctor if you'd be a good candidate for such bioptic training. This is how vision without the bioptic is, and this is how vision with the bioptic system looks. Iris vision, low vision rehabilitation technology that has various functions. You can magnify certain areas of your vision, adjust contrast, and a computer algorithm can remap the visual scene and maximize the use of the functioning areas of your vision. Alternate senses. Maximize use of your other senses, such as hearing. You can listen to an audiobook or a talking book, which is a great alternative to reading. Devices like Smart Reader HD use optical character recognition. They speak out the text from books, magazines, or newspapers. Devices like Orcam use similar artificial intelligence technology to read out newspaper, book, text messages, and emails. Maximize use of other senses. Tactile, using bumps or dots or tactile stickers placed on the microwave, the dishwasher, or the television may help identify the buttons easily. Tactile dices and dominoes are also available for board games. Tactile maps created using 3D printing can also be useful. Maximize use of other senses. So artificial intelligence, you can use voice-assisted home control technologies such as Amazon's Alexa, Amazon Echo, Google Assistant on Google Home, or Apple Siri on the Apple HomePod. You can also say commands such as Alexa, set a timer for 30 minutes, Play Frank Sinatra. Will I need an umbrella today? Setting the right expectations. You do not need 20/20 vision to do activities of daily living. For example, small print in the Bible is 20/30. Driving with an unrestricted license, you need 20/40. The small column in a newsprint is about 20/50. Newspaper headlines are 2400. Self-grooming, you probably need about 20/60. McDonald's menu, 20/80. The key is in accepting your level of vision, learning to adapt, and making the best use of the vision that you have, and overcoming the fear of going blind or losing your independence. You will do great.
The future of macular degeneration. New treatments. Stem cell therapy. Stem cells are being investigated as a way to replace the damaged RPE cells by injecting them under the retina. Research is ongoing. Retinal implant. California Project to Cure Blindness RPE1 consists of layer of RPE cells grown from human embryonic stem cells in the lab and implanted surgically under the retina. It has shown promising results. The aim is to control dry macular degeneration by replacing damaged RPE cells and preventing further degradation of photoreceptors. Gene therapy. This is another exciting field. A gene is placed inside a virus, which is injected under the retina to make a desired protein. Retinostat, such a virus-based treatment, has shown protein expression lasting up to 12 months, which is promising. While it has been successfully used to treat an inherited retinal condition, it is not yet available for macular degeneration. However, there is hope. Clinical trials. Clinical trials are research studies that are carefully designed to answer a specific question. The costs of clinical trials for developing drugs can run into billions of dollars for each approved drug. Typically, clinical trials try to compare a new treatment to a currently available treatment. They are based on scientific grounds and performed in phases. Ask your retina doctor if you are eligible to participate in a clinical trial. Ongoing trials. Some promising trials include those trying to reduce the burden of frequent injections. Port delivery system, which consists of a device implanted into the eye that can slowly release the medicine into the eye for up to 6 months. And it has a reservoir that can be filled in the office. Faricimab, which works on 2 separate pathways in the eye, may be effective, with injections given every 12 to 16 weeks. And brolucizumab, which allows higher concentration of medicine, may be effective with injections given every 12 weeks, which are both less frequent injections compared to currently available medicines. Note that lampalizumab and Zimura were clinical trials for dry macular degeneration that did not show benefit and have been discontinued. Implants. Artificial retina. Argus 2 retinal prosthesis consists of a miniature camera on eyeglasses that receives images and signals the electrodes implanted in the retina to use viable cells to produce signals to the brain. While it is primarily used in a condition called retinitis pigmentosa, it has promise for use in advanced macular degeneration as well. Camera on the eyeglasses captures the image. Antenna and the vision processing unit receives and transmits the signal wirelessly. Receiver implanted around the eye receives the signal. The signal transmitted to the retinal implant inside the eye that has electrodes to stimulate the ganglion cells of the retina, which are still functional, and then the optic nerve carries the signal to the brain. Implants artificial vision. The Orion cortical visual prosthesis is being studied for advanced blindness from other conditions where the signals bypass the eye completely and directly stimulate electrodes implanted in the brain to create sense of vision. Miniature video camera mounted on eyeglasses captures the image, antenna receives and transmits the signal, receiver at the back of the head wirelessly receives the signal and stimulates the electrodes. The electrodes implanted into the brain stimulates the visual cortex and creates the sense of vision. Bottom line, there is hope. Beware of unproven stem cell trials or stem cell clinics. As you might be aware, eye injections from fat-derived stem cells at unregulated clinics have led to complete blindness in some macular degeneration patients, sometimes in both eyes. And any clinical trial that requires you to pay should raise a red flag. Consult your retina specialist before considering any such trial. We hope you have enjoyed this presentation and learned a little more about macular degeneration. Please consider providing us feedback as we are constantly trying to improve.